The human heart is a vital organ, continuously working to sustain life. It functions as a powerful pump, circulating blood throughout the entire body. This blood delivery system supplies essential oxygen and vital nutrients to all tissues. When the heart's function is compromised, the body's overall health is severely impacted. Recognizing early warning signs of cardiac issues is crucial for intervention. Early detection helps maintain health and prevents severe complications associated with heart conditions. Heart disease refers to a broad spectrum of conditions that impact the heart's structure and function. These conditions can affect various parts of the heart, including the muscle, valves, or electrical rhythm. Such impairments can lead to a range of health issues, from mild to severe. If left untreated, these conditions can progress and become life-threatening. Atherosclerosis is a primary cause of many heart conditions. It involves the hardening and narrowing of arteries. This process is due to the insidious buildup of plaque within arterial walls. Plaque accumulation restricts the normal flow of blood. The heart is forced to work harder to pump blood through narrowed arteries. This increased strain significantly elevates the risk of cardiovascular events. High blood pressure, also known as hypertension, is a major risk factor for heart disease. It places increased strain on the heart, forcing it to work harder to pump blood. This sustained pressure also damages blood vessels, accelerating arterial damage over time. Ultimately, hypertension significantly contributes to the development of serious cardiac complications. Elevated cholesterol levels, particularly high LDL cholesterol, pose a significant health risk. This leads to the formation of plaque within the arteries, a process known as atherosclerosis. Plaque accumulation narrows the arterial vessels, impeding the smooth flow of blood. This narrowing increases the risk of serious cardiovascular events, including heart attacks and strokes. Diabetes is a metabolic disorder characterized by persistently high blood sugar levels. This chronic elevation of glucose can lead to significant damage over time. Specifically, it severely impacts the integrity of blood vessels throughout the body. Nerve function is also compromised, contributing to various health complications. This damage substantially increases an individual's vulnerability to heart disease. Coronary artery disease is a common form of heart disease exacerbated by diabetes. Obesity is medically defined as the accumulation of excessive body fat. This condition is a significant contributor to various risk factors for heart disease. One primary risk factor is high blood pressure, which strains the cardiovascular system. Elevated cholesterol levels, another consequence, can lead to arterial plaque buildup. Obesity also increases the likelihood of developing diabetes, further impacting heart health. Therefore, effective weight management is a critical strategy for maintaining cardiovascular health. A sedentary lifestyle is characterized by a significant lack of physical activity. This inactivity has detrimental effects on the cardiovascular system. Specifically, it contributes to the weakening of the heart muscle over time. Such a lifestyle also promotes weight gain, increasing health risks. Furthermore, it can lead to elevated blood pressure and high cholesterol levels. Regular exercise is crucial for maintaining optimal cardiovascular fitness and overall health. Chronic smoking profoundly damages the body's blood vessels, compromising their structural integrity and function. This damage leads to a significant reduction in oxygen supply to the heart, impairing cardiac performance. Smoking also causes a sustained increase in blood pressure, placing additional strain on the cardiovascular system. It accelerates atherosclerosis, the hardening and narrowing of arteries, a primary cause of heart disease. Consequently, chronic smoking is a leading preventable risk factor for heart attacks and other cardiac events. Unmanaged chronic stress significantly impacts the body's physiological functions. One primary effect is the elevation of blood pressure, a key cardiovascular risk factor. Simultaneously, chronic stress increases heart rate, placing additional strain on the heart. These sustained physiological changes contribute to damage within arterial walls. Furthermore, chronic stress promotes systemic inflammation, exacerbating arterial damage. Thus, effective stress management is crucial for maintaining optimal cardiovascular health and preventing disease. Chest discomfort is a critical warning sign of potential cardiac distress. This sensation is often described as pressure or tightness in the center of the chest. It may also manifest as a squeezing or aching feeling. The discomfort can radiate from the chest to other body parts. Common areas include the arms, back, neck, jaw, or stomach. Such radiating pain indicates a serious underlying cardiac issue. Shortness of breath, or dyspnea, is a significant medical symptom. It can manifest even during light physical activity or at rest. This symptom often signals underlying heart problems. The heart struggles to pump sufficient blood to meet the body's oxygen demands. Insufficient blood flow leads to a lack of oxygen in tissues. This oxygen deficit triggers respiratory difficulty, causing shortness of breath. A heart attack can manifest through pain or discomfort in various upper body areas. These referred pains may occur in the left arm, back, neck, jaw, or stomach. Such symptoms are often subtle and can be easily overlooked or misattributed to other conditions. The phenomenon of referred pain means discomfort is felt away from the actual source of the problem. Recognizing these diverse symptoms is crucial for prompt identification and treatment of a heart attack. Dizziness, or lightheadedness, can be a significant symptom indicating underlying health issues. These sensations may sometimes be accompanied by episodes of fainting, known as syncope. Such symptoms can signal an insufficient blood supply reaching the brain. This reduced blood flow is often a direct result of compromised heart function. Therefore, experiencing these symptoms necessitates immediate medical evaluation. Unusual and persistent fatigue can be a subtle indicator of underlying health issues. When fatigue significantly interferes with daily activities, it warrants medical attention. One potential cause of such fatigue is heart failure, a serious medical condition. Heart failure impairs the heart's ability to pump blood effectively throughout the body. Insufficient blood circulation leads to a lack of oxygen and nutrients in tissues. This systemic deprivation manifests as generalized weakness and persistent fatigue. Edema, or swelling, frequently manifests in the legs, ankles, and feet. This condition arises when the heart's pumping efficiency is compromised. Ineffective pumping leads to fluid accumulation in the lower extremities. Such swelling is a common and significant indicator of heart failure. Cardiac arrhythmias are defined as irregular heartbeats, deviating from the normal rhythm. These irregularities can manifest as the heart beating too fast, too slow, or skipping beats. Arrhythmias typically indicate underlying electrical problems within the heart's conduction system. While some arrhythmias are benign and pose no significant health risk, others can be severe. Certain types of arrhythmias are life-threatening, requiring immediate medical attention and management. A heart-healthy diet is fundamental for preventing cardiovascular disease and promoting overall well-being. This dietary approach emphasizes consuming fruits, vegetables, and whole grains as primary components. Lean proteins are also crucial, providing essential nutrients without excessive unhealthy fats. Limiting saturated trans fats, sodium, and added sugars significantly reduces cardiovascular risk. Regular physical activity is crucial for maintaining overall health and well-being. It is recommended to engage in at least 150 minutes of moderate intensity exercise weekly. This strengthens the heart muscle and improves circulation throughout the body. It also aids in managing weight, blood pressure, and cholesterol levels effectively. Maintaining a healthy weight is crucial for overall well-being. This is achieved through a balanced diet and regular exercise. Even modest weight loss can significantly reduce the risk of heart disease. It alleviates strain on the cardiovascular system, promoting heart health. Avoiding all tobacco products, including smoking and vaping, is crucial for maintaining optimal heart health. Tobacco use introduces harmful chemicals into the body, damaging blood vessels and increasing heart disease risk. Quitting smoking is among the most effective actions an individual can take to reduce cardiovascular disease risk. Cessation leads to significant improvements in heart function and overall cardiovascular well-being over time. Regular medical checkups are fundamental for maintaining overall health and well-being. These appointments enable the monitoring of vital health indicators, such as blood pressure. They also facilitate the assessment of cholesterol levels, a key factor in cardiovascular health. Furthermore, Blood sugar levels are routinely checked to detect potential metabolic issues. Early detection of these risk factors is crucial for timely intervention and management. Proactive management can effectively prevent the progression of serious conditions like heart disease. Treatment for heart conditions is highly individualized, based on specific diagnosis and severity. Initial approaches often involve lifestyle modifications, such as diet and exercise. Pharmacological interventions include prescribed medications to manage symptoms or risk factors. More advanced cases may require medical procedures like angioplasty to open blocked arteries. Bypass surgery is another procedural option, creating new routes for blood flow around blockages. Advanced medical interventions are crucial for severe heart conditions. These conditions include severe heart failure and complex arrhythmias. One such intervention is pacemaker implantation. Another advanced treatment is heart transplantation. These treatments aim to restore optimal heart function in patients. Ultimately, the goal is to significantly improve the patient's quality of life. This video is produced for educational purposes only. It provides general information regarding heart health. This content is not a substitute for professional medical advice. It does not replace diagnosis or treatment from a healthcare provider. Always consult a qualified healthcare professional for medical concerns. Seek professional guidance for any health-related issues or conditions. Please kindly subscribe, share, and like this video for daily health matters.